long-term survivorship care after cancer treatment. If you tried to fly to Washington in the summertime, as I did, and even if you weren't an expert on survivorship, you were by the time you got to Washington National. So we really appreciate your taking time from your summer to come join us. I think, as many of you know, we visited this topic some years ago, so this symposium will be a tremendous opportunity for us to catch up on how the discipline has grown and matured, and really focus on ways to take it to the next step, and particularly to have broader and deeper impact across a larger swath of our patients nationally with cancer. My job as chair of the forum is simply first to, for those of you not familiar with the National Cancer Policy Forum, just tell you a couple things about it, and then to introduce our moderators for session one. So I'm going to read this because we have a connection through the national academies to the government, so I want to be sure I use exactly the right language. The National Cancer Policy Forum serves as a trusted venue in which experts can work collaboratively to identify emerging high-priority policy issues in cancer research and care, and to examine those issues through convening activities that promote discussion about opportunities for action. These activities inform stakeholders about critical policy issues to publish workshop reports and often provide input for formal consensus committee studies. The forum provides a continual focus for cancer within the national academies. The forum addresses issues in science, medicine, public health, and public policy that are relevant to the goal of reducing the cancer burden, both through prevention and by improving the care and outcomes for those diagnosed with cancer. And I know many of you have served on the forum or have served on activities we've done before, and know that the reports we prepare from these workshops do often find their way into the discussions around important policy issues and have an impact and have resulted in the way that people think about those policies and actually implement them. So the work we do today hopefully will have that kind of impact in the future. I just want to take a quick moment to thank these sponsors for the National Cancer Policy Forum who've helped to make this workshop possible. As you can see, it's a long and very distinguished list, and many of these organizations have been continual supporters of us, for which we're grateful. Also want to thank the workshop planning committee members chaired by Patty Gantz and Ron Klein, who are going to join me here in just a second. I know from being on these calls that a great deal of thought went into how we organized the meeting, how we arranged and sequenced the speakers and presenters. So we hope that work by this group will show up in the next 2 days as a wonderful forum, and one that, as I said, does have impact. So thanks very much for attending, and with that I'm going to ask Patty and Ron if they'll join me.